out so much of this.
And we have a 5-minute podcast.
Yes. So, hey, anyone listening to this podcast, you've got me, Mackenzie, and...
Me, Carrie.
Yeah.
I think.
Yes. Unless you're someone else today.
No, I haven't decided yet.
Not today. Yeah. We're here and we're going to be talking about our movie of choice, but I figured before we talk about the movie and all the things we want to discuss with that, we could give a little bit of a background of ourselves. I am a psychiatric nurse practitioner and I love my job. I love what I do, and I kind of bringing that perspective to this podcast in addition to just being overall a movie lover. Like, I probably, if I were to list my qualities as a person, maybe movie lovers above nurse practitioner, and then that comes next. But, you know, that's the kind of perspective that I'm bringing to the table with this, because, you know, when I listen to other podcasts, people like talk about their qualifications and they're like, you know, I'm an expert in this, or like, I have a lot of experience with this, and this is like my passion or whatever. Like, I would say movies and mental health are my passion, but I don't really claim to be an expert in anything.
Yeah.
You know, I didn't want anyone to get any misgivings about how qualified I may or may not be. This is more of a personal benefit, this podcast. There were reasons, Carrie, that I asked you to be a part of this with me, and it was a lot to do with, like, I needed a creative outlet since COVID, and, you know, slightly too, since becoming a mom, I felt like I haven't been able to do much creatively, like using that kind of part of my brain. One of the inspirations and ideas behind this podcast. Hopefully you felt the same since you agreed to do this with me, but...
I'm being held hostage in my own basement. And I've been told I have to watch these movies.
Please help me. Please alert authorities.
Well, tell the people how we met. Do you remember?
I love talking about how we met and then how we bonded.
Dream.
Yeah, no, I feel like we should talk about both. So I met you through our friend Kayla. Mm-hmm. So shout out to Kayla, because I know you're going to be listening to this. Kayla and I have been friends since high school, and then when we went to the local community college and she started working, you know, maybe we should just talk about Kayla for a second. How did she
Why don't we diagnose her with some stuff?
Let's talk about Kayla in detail.
Who we adore.
Yeah. Did she just walk in and interview at your dad's coffee house? Like,
she did, and I had not met her, but I was told by the manager at the time.
Oh yeah, because it wasn't even your dad's coffee house at that point. It was the other
still under someone else's ownership. Yeah. So Kayla comes in, and I'm like, this is amazing because I hate to sweep, and this girl looks like she would love it.
Well, she does like cleaning. Even though she well, I shouldn't say that. I shouldn't say love. The girl has a compulsion to clean.
I do not share that compulsion.
No, I don't share that compulsion either.
I also don't have children, though, so.
No, but she's always been like that. Kayla, if you're listening. She wouldn't be able to sit still. The only thing, oh man, I don't know if I should be saying this. I wanted to throw her under the bus, but the only thing.
You can throw her off the bus.
Kayla, I'm going to text you later about this, Kayla, and find out if I'm okay to say it on the podcast. But the only thing that was like super messy for Kayla from as long as I've known her is just her car. Like, there would be, do you know what I'm talking about? I would in her passenger seat, and there would be water bottles and all kinds of stuff that
Listen, this is a little off track.
We're getting
However,
so off track.
But to talk about her car, my bachelorette.
We're talking about the green car, right? Are we talking about her old green car?
Yeah, when you guys took me out for my bachelorette, Kayla picks me up. She's like, oh my God, I don't have a blindfold. She had to move all this garbage off the seat. She wrapped a sweatshirt that she had worn at the gym earlier around my head, and then told me, here, get out here and stand on the corner with this around your head.
I forgot about this.
I'm like, Kayla, I am not being shoved out on a random corner.
Oh my God.
And standing there waiting for someone to find me. But yeah. So that's how I met Kayla.
And then how I met you is I showed up at the coffee house.
Yes.
After you guys had started to become friendly.
Yes.
And Kayla was like, I really love this girl. Because at that point you were a girl.
I've turned into a hag.
I know. I'm not that far behind you. But she was like, you know, there's this girl I work with I love. You're going to love her. You have to come and, like, just hang out with. Depending on what time of day it was at the coffee house, it was not busy, which was usually, you know, towards the afternoon or whatever. So after class, I would come, and then Carrie, it was just love at first sight. I don't really know what else to say, but.
And then we took a poetry class together.
I know. And guess what? I was looking at some of my old poems the other day from that class. Mm-hmm. There's one that I still really like. So our poetry class was with the very intellectual, very creative Bruce Weigel. If you haven't read anything that he's written, you really really should.
Absolutely.
But he did not, I don't know, he was not a fan. I don't know if he was a fan of any of my writing, to be fair. There's one poem called The Promises He Didn't Keep. I'll show it to you later. I'm not going to read it out loud on the podcast right now. I still really I don't know, I stand by it. I stand by that poem.
As you should.
Thank you. But yeah, we took that class together, and I think that was just it.
Yep. You and me in the back row, which I did not approve of because I am a front row sitter.
Why did we go in the back row? Was that my choice?
That was your choice.
Why did I choose that?
I don't know.
I don't know, because I'm not necessarily a back row.
But there were some guys you knew.
In the front? No.
No, they were in that back row. Joe and...
Did I know Joe? Oh, because I took philosophy with Joe. Yes.
So I think it's just like you knew the people back there and you're like, let's just go sit back here.
Yeah, just so we can have people to BS with, like, when we're supposed to be paying attention, really.
And yet I didn't want to BS.
You're like, I'm here. I've led you astray so many times. I'm the bad influence. But Carrie, beyond you just being my friend, the reason I wanted to do this podcast with you is, one, I love your humor and I love your intelligence. But yeah, I mean, I wanted to do this podcast with you because I can't talk into a microphone void by myself. That's not fun for me. Don't think it's going to be fun for other people listening to either, but I really appreciate the way that you look at things and your critical eye of like dissecting things, and I think that is what is needed for me to have a good conversation. I mean, I always feel like our conversations are great. Like, I always learn something from you, and that was like one of the driving things for me to be like, I can really only do this with Carrie. I can't see myself doing it with anybody else. So thank God you said yes. So I wanted to say thank you for agreeing to do this with me.
Well, thank you for asking me, because I'm like, really? She wants to do that with me? Like, she wants to do a podcast?
Absolutely.
And then I found out the topic, and I'm like, oh, I'm in. And I have lists of movies.
Yes.
That would, because I like those kind of dramatic, emotional, psychological type movies.
Yeah.
To introduce a little bit about myself, I have a master's of fine arts and poetry, and love that. I love everything to do with that. Mm-hmm. And I do...
Your bachelor's is in history, too, isn't it?
Yeah.
Don't forget that, girl.
My bachelor's
We both have bachelors of history.
Yeah.
Us historians.
Who went ahead and did something else.
Yes, exactly.
I mean, I've been in therapy, so I just find a lot of this really interesting, and sometimes I can see the perspective of maybe the person struggling a little more, whereas you're coming at it from the therapist type side.
Even though I've been on that other side too myself.
Yeah.
Just definitely not as much as maybe other people, I would say. But
Are you looking at me when you say that?
No, I'm thinking of people I treat when I say that.
Okay.
But yeah, but the other thing too, Carrie, I mean, coming back to your Master of Fine Arts, like you've read things way more than I have. Like, you and I have read some of the same things, but you've read things of people who have suffered from mental illness. Mm-hmm. So when we're looking at this visual portrayal of these stories, I mean, you can come at it from a storytelling perspective that I'm not a good storyteller.
We're like two peas in a pod.
I know. We're the yin and the yang.
We are so much part of a mutual admiration society with each other.
I'm all about pumping my women up, in a very...
What Kinsey needs to remember is that...
Yes.
Sometimes I'm a little too quick-witted and things fly out of my mouth when you say something.
Yeah, we're going to have to keep it in check. But the other thing is that I can always edit what
that's true.
I can't add things.
Tell me more about those blow-up dolls.
Okay. That will be when we watch Lars and the Real Girls. Yeah. After we discuss a movie, at the end of each session that we do, each episode, we're going to be picking the next movie randomly from a jar that I have of written little paper notes. And for movies like Inside Out and Inside Out 2, I've seen them. Carrie has not. So I'm
not a cartoon girly.
You might be after you watch that movie. It could be life-changing. Who knows? But regardless, I think if we were to watch Inside Out 2 without Inside Out 1, which you don't necessarily have to watch the first one because they're separate kind of stories, there is stuff that you miss, like you don't understand.
You need that continuity to get it.
Yeah, so that one would be like a double feature that we would do. We'd watch two movies, but I mean, typically each time that we discuss a movie, it's just going to be one. All right, and then with that, we might as well just get right into the movie we're discussing. So I chose the movie for this first episode. Thank God Carrie agreed with me, but, honestly, you're the one that turned me on to this movie.
This is true.
Because I think you just kind of, in conversation all those years ago, like, I don't know, 17 years ago, whenever our friendship was blossoming, you mentioned it to me, and then I did watch it. And I do remember I watched it because I rented it from the library that I was working at. Took it out when I worked in the audiovisual department, and that's how I
you
borrowed
watched
it.
A lot of really good movies.
I did. Now, I guess we should move on. Let's talk about the movie.
You can also rent Chicago. All that jazz.
I had to curb that urge right there to start singing the song.
You know, we should have like a podcast after dark where we just drink and sing and read our sad poems.
You heard it here first. That's going to be, that's in development now.
We're going to need a book club. We're going to need an after dark.
Let's do it. All the things. I'm for it. Okay, so the movie we're going to talk about today is Girl Interrupted. So this is a warning to anyone who's listening right now that if you have not seen the movie, you might want to stop and not listen right now because it's going to be spoiler, all the spoilers. And so if you haven't seen it but don't care about spoilers, obviously keep listening. Carrie and I are going to be discussing this movie in detail, so this is your final warning if you have not seen the movie. And this will be for every other episode too. We'll give like a little, hey, spoilers are going to be coming. Might as well stop listening now for Girl Interrupted. So,
and also, if anyone has read the book, we're not critiquing the book. That's the one thing I had to keep reminding myself in my notes.
Right.
I'm like, but what did the book say? It doesn't matter.
Right. I was going to bring the book up during our conversation.
I mean, we can totally talk.
Yes.
I mean, that's where this has come from.
Yeah.
But we're not critiquing the book. We're critiquing the movie and the portrayals of mental illness in the movie.
Yeah. So just a little information about the movie. I just have this written down, Carrie, when I was watching it. I wanted to look up this information. So it came out in 1999. And I remember, which I'm going to talk about here in a minute, like Angelina Jolie's acceptance speech at the Oscars. Like that was when I first had heard of the movie. It was directed by James Mangold. The writers for the screenplay were Susanna Kaysen, who's the author of the book who the whole movie's based on, James Mangold, and then Lisa Loomer. And then did you know that Winona Ryder, who is the star of the movie, she's a producer for this?
I did not know that.
Did you know it was her first movie that she ever produced?
No.
So
she must have been very passionate about that project.
Yeah, so I watched, after I rewatched the movie, I watched HBO's The Making of Girl Interrupted.
I did not know that
it exists.
If I can get on there this afternoon, I would love to watch that.
It's like 14 minutes long. It's not super long, but Winona talks about how she had heard about the book before it was even published. So Susanna Kaysen, I'm not exactly sure. Winona doesn't go into great detail about how she heard about the book, but that she was aware of this book that was a memoir that was going to be published, and that people were looking for the rights to buy the book. And then it ultimately went to a guy named Douglas Wick. He's like the primary producer. Mm-hmm. And then Winona was, I guess, so interested, and there was like a little bit of a bidding war that he agreed to have her on as like an assistant producer, executive producer, or whatever. So, but she knew about it before it was published. So basically the book gets published in 1993. And then around the same time, the rights for the movie are bought by Douglas Wick, and he was...
Surprise you when you read that the book came out in 93. I thought it had been, because it takes place in the 60s probably, mm-hmm. I'm like, oh, this was probably in 1980s.
I would have bet 1980s.
Yeah.
You know, it's in the book. I don't really feel like pulling it up, but like we know when she was in
it was the
hospital.
Late 60s.
Was it the late 60s?
Wasn't it?
So this is
she was admitted, I do have some research from theconversation.com.
Okay.
That she was admitted when she was 18 in 1967.
Okay. I'm going to bring this back up when we talk here in a little bit about some other things that are in the movie, but like the timing of it was a little confusing for me. If you didn't know any backstory to it, or like let's say if you had read the book and then watched the movie, I don't think it would have made complete sense. And I'll bring that up in a little bit. And then it has like an amazing cast. Can we talk about the cast for a second of this movie?
Absolutely.
Okay. So Winona Ryder, 1. Angelina Jolie, 2. Amazing. Clea Duvall as Georgina, who we'll talk about here in a little bit too. Amazing. Brittany Murphy, R.I.P. Brittany Murphy.
I mean, she was so talented.
I know.
And just...
What a range.
Oh my gosh, yeah.
I mean, I fell in love with her watching her in Clueless.
Yes.
That came out before this movie.
Yeah. That was her... I remember that there at that party.
Rolling with the homies. God, Brittany, oh.
That's probably copyrighted.
I know. No, I think as long as I'm not playing the music, right?
Yeah.
We should be safe.
Oh, sure. We're fine.
We're fine. Yeah. Ignore us. But yeah, Brittany Murphy and then Elizabeth Moss. Okay, first time I watched this, her character, which we'll get into, is disfigured in the movie. So, like, it's not her face, you know, like, there's alterations.
Lots of prosthetics.
Right. But when I rewatched it, I was like, oh my God, that is Elizabeth Moss. I love Elizabeth Moss.
I mean, the talent and that generation of actors, my goodness. You know, it's just, it's a gift. It's a real gift to get to watch people who are so talented tell this story. And I will say that's probably one of the best parts of the movie is watching
the interactions between all of them. Yeah, I think it makes the movie. But then also too, we cannot forget my boy Jared Leto. I mean, he has a small part in comparison.
Okay, and don't even get. I love me some Jared Leto.
But
no, I love him, but I just keep wanting him to get back with Angela on My So-Called Life.
Don't even. Oh God, this is such a sore spot.
I'm still bitter all these years later.
I'm so bitter that show got canceled. Like, why do you have a masterpiece like that in television and then?
Because that's what always happens. I'll get hooked on these amazing shows that are different and maybe more cerebral. And then critically acclaimed, but hey.
Jeffrey Tambor is it Tambor or Tambor?
Tambor.
Is it Tambor? Okay, yeah. He stars as the therapist Melvin Potts, which his role is smaller too. But there's like some humor in the interactions between Winona Ryder and his character when they're like doing their therapy sessions. But then, oh my God, Whoopi Goldberg. Dude, I feel like that was such an underrated role for her. Nurse Val could have had her own movie, but
yeah, and I feel like I wish there had been more Whoopi.
I know, I wish there had been more too.
But she adds such a subtle like performance of being strong, calling people out on their shit.
Yes.
And
I know, I loved it. And honestly, like, thinking about Whoopi's character versus, like, portrayal of Nurse Val that's in the book, I like Whoopi's portrayal better than what's in the book. Although you get more of Nurse Val in the book. I just think Whoopi is great. It's just so...
I thought you were going to say, well, she's not like Nurse Ratched. And I'm like, correct.
And that's another podcast another time, right? I have my soapbox of like how psychiatric nurses are portrayed, and actually Val.
Do you think that portrayal comes about of them being, I don't know, cruel or like?
Let's get into it because that was one of the things I wanted to talk about.
Not understanding is because of Nurse Ratched.
Probably. It's One Flew Over Cuckoo's Nest is on our list of movies to watch, so we'll get into it more than that. But I think that it has a lasting impression of what a psychiatric nurse is because of Nurse Ratched. I think it just is.
I also feel like mental health, mental institutions, psych wards are so taboo even today.
Yeah.
I think it was like, it's the boogeyman anyway. And then you see Nurse Ratched and you're like, that's right.
Yeah.
That's exactly what it's like in there.
Terrorize you. It's torture, right? Like they're torturing you. I think that, so this is one of the things I wanted to talk about was like the portrayal of the nurses in the movie, and specifically Nurse Val, since that's the one you see the most. I think it's a nice foil to what we normally assume with that. Like if we're using Nurse Ratched as the stereotypical or like the standard, you know, like even though it should not be.
People's minds.
In people's minds, like in acceptance or expectation, right? Like if you're going to get hospitalized. But I love her. So like she has a lot of great lines. Actually, I'll bring those up later. But I think that Whoopi's portrayal is great. I think that she brings a sense of like empathy, like and trying to meet these women on their level, right? Like trying to have like real conversations with them, not talking down to them, but at the same time being like, get your shit together.
Right.
Like
I'm not taking this.
No.
She has boundaries, doesn't she?
Boundaries. Yes.
God.
She does.
I've never met one of those. What are they like?
What is a boundary? I get asked that so much at work, and we might have to go into that when we're talking here in a little bit. But yeah, she has boundaries. She holds her boundaries. She also wants the women to like set boundaries and, you know, trying to get them to do anything.
Yep.
Herding cats in this movie. Okay, let's start with like the opening scene because that was one of the things I wanted to talk about. I don't know if that was like, oh, this is going to be our section, folks. In these episodes where Carrie and I compare notes. So we've both taken notes on this movie that we've watched separately, and we'll probably watch maybe a movie here and there together, which we'll probably take we'll take separate notes or whatever, but we're going to compare notes now. So my notes, I have the opening scene I wanted to talk about. So the narration of this opening scene, right? The opening scene of the movie, again, spoilers, here they come, is that the opening scene of the movie is you see Winona Ryder's character, Susanna Kaysen, being wheeled into the emergency room, right? Like, and you have all of these staff that are like emerging and converging like on her and to treat her. And then you hear like the narration where it says like, maybe it was just the 60s, or maybe I was a girl interrupted. Like there is like that narration as she's getting wheeled in, because what's going on in her mind. But like, I just thought that was so funny. It's like, maybe it was the 60s. And then I guess that's where the title of the movie comes from, at least in this line. In the book, it's different.
Yeah.
Yeah, which we can talk about that maybe later, but I just thought that was funny. Did you like...
You know, every time I hear it, I'm just like, cheesy.
Yeah, very cheesy, right? It's like comical. Like, it's like, I think it's meant to be taken seriously, but it's like, really? Anyway, like, not a fan of that line. There's lots of lines in the movie that I'm a fan of, but not that one. But then the doctor orders for Susanna to get 5 milligrams of Valium IV. Holy smokes. Like that, I've never taken Valium. I've obviously prescribed Valium to people, but that's a lot to hit somebody with. And in IV too, like she's gonna go right to sleep. It's a muscle relaxer. It's like it's super sedating. She's getting wheeled because she's overdosed, and she's kind of out of it anyway. Like, I don't know why they're giving her Valium. I wonder if they're giving it to her because she's getting her stomach pumped.
I don't know. I really, that whole scene, like, I know what Valium does, but I didn't know 5 milligrams was like a lot, because I'm not.
10 is the max that you should give at one time. So 5 is like half of that. The thing is too, like, she's 18 when this is happening. Again, and this is not in the book, this whole scene. This is something that, as to whether that really happened or not, they obviously adapted the book to a screenplay. I wonder if they just added this in. But that it's not a whole lot to give, but the thing is, she's 18, so at that point, when we're prescribing meds, they were doing it back then, but now we have to be careful about weight. She's a small person.
So tiny.
And so...
one of the waifs of the 90s.
I know. Okay, so I have a list. We're jumping ahead, but I have a list later that after we talk about these different scenes of things I loved and didn't love with this movie. And the things I hated is Winona Ryder's clavicles.
Your clavicles are staring at me.
They're
I hate
in every
it.
scene. The clavicles were a paid actor. I mean, she's a tiny woman.
I wonder if she got them insured by Lloyd's of London.
There's probably makeup on the clavicles. Like, let's make them more prominent.
Let's contour those.
Yes. So yeah, that was on the list of things I hate, were Winona Ryder's clavicles. But she's just very small, and so it's just like, I think that, I don't know, that was
just way too much. Do you think?
Possibly. And then also too, there you see her with like the leather restraints. They've got her. I mean, that's like a very typical psych person thing. People, they scare people like, you're gonna go in the leather restraints.
Do they really?
Professionally, we don't. Like, it's not something that we like threaten people with.
Is that still like someone comes in after a suicide attempt?
I've had to put people in leather restraints before. Because they're usually harmful to themselves or other people. So like, I don't know why they had her in leather restraints, other than if she's coming to out of this OD, and if she's like...
she could have been combative.
Yes. Yeah. But I don't think they wouldn't have had what we call soft wrist restraints. So that's what we normally use with people. And it's like a foam restraint with a tie or something.
And we wonder why people are freaked out about mental health institutions.
Seriously. That's that example. But then her line of like, you should check my hands because there's no bones in them. Like, something that's in the book too.
I thought that was interesting. I wondered when she said that, is that because she's having a moment of not feeling real and depersonalized?
That's what I think. Okay.
Or was it supposed to be like in the movie, like a signal like, uh-oh, she's not okay?
I think probably both. Yeah. I would say I think because it's in the book, we know, again, per Susanna's kind of recollection was that those were things she was thinking and saying at the time. But I do think that was like setting up. This is a setup, right, for the rest of the movie of like, this woman is not right, in quotations. Okay, I have my next scene I want to talk about. Is there any scene that you want to talk about?
The next scene that she goes to, they show her interactions with
Dr. Crumble. That's what I wanted to talk about too.
Okay.
I only have one thing. The one thing I liked about that, and this was one of the things I wanted to talk about in general with the movie, of the things that I loved, was I liked that you see it a lot with this scene, but you also see it in a couple other scenes. As she's talking to Dr. Crumble, her mind is going back in time. Like, you get some of that backstory because it's, she's thinking about things from the past. That's my understanding, is that she's remembering things, right? And so then we get a look at that, what she's remembering, like the conversation at the party with the Gilchrists. And, but I thought that scene was interesting. But I have in my notes, I said, Jesus, the guilt trip, when Dr. Crumble said, you're hurting everyone around you.
That is the quote I have.
Oh my God.
I was just like, okay, so you have a young woman.
Yes.
Who has tried to kill herself, and you don't care about her, you care about her parents. And it reminded me of my maternal grandmother. And it was just that generation. She was born in 1930, 1928 maybe. And she always would say, "What will the neighbors think?" And I think back then...
And that's a line kind of in the movie, too.
Yeah, like so much back then, and I think even today is, yeah, but you're embarrassing us in front of our friends, you know?
Yeah, basically.
And now we're going to lock you away.
I don't feel like that has changed much, actually. Like, compared to back then and now, I feel like that's still very much a thing that goes on with families. If someone's diagnosed with like a serious mental illness, they're like, you know, how do we explain this to people that we know? Or like, you need to behave, or, you know, we can't bring this up. The ways that people can get better is like about talking about these things. Like, I know that there's things that happen that people are probably embarrassed by, and like
there's this old it's been memes, but I've heard it before they became memes.
Yeah.
My family is relocated north into Ohio from Kentucky and West Virginia. And one of the things, like, in the South, we don't hide our crazy. We put it on the front porch and let it wave. And I love, it's not true, but I love that idea of like, whatever, it's okay.
And, you know, that was something, not to get too ahead of ourselves when we're talking about this movie, but in watching the making of documentary about the movie that HBO kind of put together, they were trying to, they said one of the things that they want to do was to show that these are regular people in a hospital, and that it's not about all of the extremes and about, even though extreme behaviors, like, it's not necessarily meant to be about that. It's about these are regular people with maybe some things that they're doing outside the norm, but at the same time, they're like people, right? Like humanizing it. So was there anything else besides that line with Dr. Crumble that you wanted to bring up? Because was going to move into something else.
The next thing I make note of is the cab driver.
Oh, yeah.
That conversation, like, he's asking her personal questions. First of all, they just stick her in a cab and say,
yeah,
have fun at the mental institution.
Right, and she doesn't say goodbye to her mom or her dad. She just sees them in another car. Like, that's sad.
I just thought, sir, none your business.
Yep.
And also he tells her, "Oh, everyone's sad," which is the most frustrating thing.
Right.
Someone dealing with a mental illness can be told, at least from my perspective.
No, I mean, I got that too.
It's that, and you hear that kind of throughout, like, well, oh, everyone's like that. Everyone's like that.
Right.
It's like, to some degree, but mine is, I don't know if pathological is the word, but mine is a medical condition.
Right.
And yes, everyone gets sad, but not everyone gets sad and takes 50 aspirin.
Right. Which is what she did. Yeah. Right. No, I agree with you. I mean, I think it's
just kind of like, oh, just shape up, you know, pull yourself up by the bootstraps.
Yeah, like, it's giving, right, as the kids say.
Okay, only.
This is not enough a reason for you to be going to this place, right?
Right. Like, why can't you just get it together? Which, when you have mental illness, all you want to do is try to pull yourself together.
Yes.
But you are ill. You cannot do that without some help, and it might take decades.
And it certainly was, like, confusing on some level. Like, it seemed very rushed, but that's kind of part of the movie, too, is just, like, what we were seeing of her having this meeting with Dr. Crumble, and then basically saying, you're going to go to the hospital. He makes that phone call while they're talking, like, hey, you're going to go, and then she gets in the cab, and that's where we're at. But then, like, the next thing I wanted to talk about was, like, Nurse Val, when after Susanna gets admitted to the hospital and Nurse Val's giving her the tour, and then she meets Lisa, like, that all kind of happens in that one scene.
Yeah.
So, I mean, I think Nurse Val is, being very kind, trying to make it, like, seem as not a big deal, like, just showing her the lay of the land with the unit and things like that. And then you see all of the patients that are around and, like, doing their different quirky things, right? Like, in that scene, too, there's the one character, Janet, has the anorexia, and she's, like, yelling about, what was she yelling about? Oh, her clothes. She was like, give me my clothes, remember? And then they were, like, basically saying that she had to eat. And that was funny. But then Lisa comes in right after that. So I had some lines that I thought were hilarious. You see Lisa. So Lisa's character is played by Angelina Jolie. We're going to pause for a second. Do you know that she cleaned up with awards with this? Did you know that?
Oh, yeah.
She won 4 critical awards for her portrayal of this.
That was kind of like the announcement of, hi, I'm amazing.
Yeah. Elisa makes this movie, right? That's my opinion.
I would agree with that.
Yeah.
I would say that, like, I definitely, I don't know, like, and I think it's probably because they make it seem as though Lisa is almost free in a way the other women aren't, because she says what she wants. She doesn't care what people think. She doesn't care if she hurts your feelings.
Right.
She doesn't care who she screws over.
No. And that's, yeah.
And there is a freedom in not caring.
But there's lots of other things with Lisa. Well, so here's for an example, right? Lisa's free, but I put down this line in my notes. Lisa talks to Polly. Polly is Elizabeth Moss's character who has the deformity. She says to Polly, "Miss me?" And then Polly's answer was, "Not much." and then as Lisa's like creating chaos on the unit by her coming in, Georgina, who is Clea Duvall's character,
who's terrified.
She's just like, she says, "I can't deal with this," and like shuts the door, goes in her room. Obviously, Lisa is free in some kind of understandings, but she's also like creating chaos.
And if I am remembering correctly, she calls Elizabeth Moss's character, what's her name again?
Polly. She calls her Torch, right?
She calls her Torch.
Yeah. You know, it's kind of insulting, right? Like,
kinda. Well, and to explain, she had set herself on fire as a child.
Yes, because the explanation in the movie, which you get it in the book too, was basically that her dog, her puppy, she was allergic to her puppy. They were going to have to get rid of the puppy.
Her skin was allergic and she had hives or something.
Right. And so she sets her, and as a child, like at age, like, I don't say what was her age? Like 7 or 8 or something?
It was young.
It was very young, but she sets her skin on fire. You know, she tortures her to get rid of the hives. And then she's essentially has a deformity on her face, you know.
Which, am I the only one who thinks logical? But
Carrie,
but to a child, you can see how they would think, well, if I get rid of the skin,
right,
and they can't see the rash.
But this brings up other questions to me too, like as an aside, depending on what age she was. And again, we're taking this as something that actually happened because this movie is based off a memoir by Susanna Kaysen. This was her writing about her experience, and she could have made some of these things up. You know, we can maybe get into that in a little bit, but the character of Polly is someone that probably existed, that, you know, if we're just going to assume
and it could be an amalgamation of people.
Right. But then it brings up my question of, like, depending on her age, because they're developmentally, you know, kids don't have like that literal kind of logical process, you know, they can
they wouldn't necessarily think, I need to get rid of my skin.
Right, depending on the age. So then that brings up things. I was wondering if like maybe Polly's character was like someone with like autism that we didn't see, because like people with autism can, like, they have a literal, that's like a very literal conclusion to say, like, if I get rid of my skin, there's no more problem with the puppy. Or maybe not necessarily autism. Like, there's some people with autism that way, but like, or like an intellectual disability, right? Like, so if she was intellectually disabled, depending on her age, thinking that that's a solution.
Well, and do you think, like, people who experience, this is what I've heard.
Yeah.
Word on the street.
Word on the street, okay.
Is that, you know, if you have something very traumatic happen to you when you're young, you might stop maturing emotionally past that age.
100%. Yes.
Because you see, she has a doll. She, you know,
her character is very
childlike.
Yeah. No, that's definitely a thing that happens. Now, that doesn't happen to everybody, but if your psyche breaks because of that traumatic event, think of it as like a fracture. Like, we call it like emotional stunting, developmental stunting. So like they are stunted and in very severe cases left at that state. You know, there's no progress.
And then I can only imagine the trauma of having that treated.
Right.
And the pain and the...
Because this is the 60s. Yeah. I mean, I don't know what they're...
And even now, I think, like, for burn victims... They have to scrub off skin and make sure it doesn't. And she was young. That would have been horrible.
Right.
Just
the next scene I wanted to talk about was Daisy and the Colace.
Okay. I also wanted to mention. Let me mention one thing. Is that when you go from the outside, the institution, to the inside, like on the outside, everyone's saying don't talk about it. You get into the mental institution, and that's all they are very open. Yeah. And they're very matter of fact. And I found it a welcome change to like the judgmental outside world. And I think the character of Susanna in the movie almost comes in and is having maybe the same reaction as the person watching the movie, like, holy shit. Where I am not like these people.
Well, yes. And So we can talk about that a little bit more too, because one of the things I wanted to bring up was the theme, or at least one of the things that the producers that they talked about wanting to convey with this was considering it like a coming of age story. The look on your face, Carrie, is like that skeptical look I probably had on my...
Does this not mean that in your gap year, you go to a mental institution?
Right.
You know?
Yes. I don't know if I would say it's a coming of age story. I feel like that is a stretch. I feel like that is trying to put it in a category it's not. Because when you think of a coming of age story, usually you're thinking of common experiences that people have together. So it's like a shared experience.
And there are these like certain milestones that maybe you have your first heartbreak, or you know, these universal experiences.
Yeah.
This is not a universal
Like when I think of a coming of age story, I think of the movie Now and Then. That's a coming of age story. This, I would not put in that category. No. Which we probably should add Now and Then to the list, because that is such a good, I feel like we could talk about it.
Okay.
Anyway, moving on. Daisy and the Colace. So anyone who doesn't know what Colace is a stool softener. And it's a gentle stool softener. So this is the nurse and me talking about medication. There's this scene with Daisy, who is Brittany Murphy's character, and she really wants Colace because she's constipated. But there's kind of this sense from the conversation that's had is that Daisy abuses laxatives, right? Yeah, because she's like restricted from having them, you know.
If you take Colace and you abuse it, can it shut down your bowels? This is a weird conversation.
I know, right? Where are we going? Okay, so...
I guess that's... And I was like, well, she's also... But she eats the chicken.
Yes. So from that medical question, that is something I would have to research and come back. However, I would assume so, in that it softens the stool. That's what that medicine does. And then also Daisy like asks for other things. She asks for... a laxative. I forget which one she used. She asked for a specific one in the movie, which is a real one. But with the Colace, I think that it could make it just more... I don't think it will slow the bowels down completely. If you take it every day, I think without it, it would make it hard for you to go. But I don't think to the point where your bowels will stop. You know what I'm saying?
Just maybe become sluggish.
Right. Because Daisy's character is supposed to be obsessive, right? Like that's her diagnosis, is that she has OCD. She's obsessive about her bowels. She's obsessing about having a bowel movement. So, but in this scene, right, we get to learn why she's constipated. And the reason is because she only eats her father's chicken, right? Okay, so I wrote this down because I loved this line. What happens in this scene, which I think is just so funny, is Lisa weasels her way into Daisy's room, getting Susanna to give her the Colace and like kind of like sneaks in the door. Mm-hmm. And then they're in that room talking, right? And then Lisa's like saying like, what's that smell? Lisa knows. The thing is, like, you can tell on her face, like, she knows. Susanna does not know. Because, right, this is like Susanna's like first real interaction with Daisy. Mm-hmm. Susanna doesn't know. Lisa knows. And then they see the chicken underneath her bed. Lisa pulls that blanket up and you see the chicken. She knows
exactly where it is.
Exactly. Yeah. And then Lisa asks, what's with the chicken? I laughed when she said that. Like, what's with the chicken, Daisy? And then after they find the chicken carcasses, Lisa's asking about the chicken when she sees it on Daisy's bed. But then when they find them underneath, Lisa says, that's fucked up, Daisy. Just like... that I laughed so hard. Angelina Jolie's delivery of that line, classic. Loved it.
I mean, and I found myself surprised, maybe not surprised, but I would just like bust out laughing. Yeah, Lisa, manipulative.
I know. Which I want to talk about Lisa here in a little bit, like her person, because I have a question for you. I have like kind of a list of questions of what you think. Okay, the next scene I wanted to talk about was the family meeting with Melvin and her parents. Was there another scene you wanted to talk about?
Well, I just wanted to make a comment about how when Susanna comes into the ward and she's reacting like the audience would.
Right.
And made me almost feel like they're setting it up as though Susanna really isn't crazy like these bitches.
Right.
And then I thought, well, maybe she's going to learn to accept that part of herself, that maybe more out of control part of herself. Throughout the movie, it's just like, so what are they saying?
Right.
What is the point of this movie? Are they saying, nah, she just slept around and, blah, blah, blah.
Yeah.
And there's nothing wrong with her. Nothing to see here.
Right. Well, I had a couple notes about that too, kind of bringing it up, which we could probably, we might as well talk about it. So like you were talking about control, right, with Susanna. There's a line in the movie, I haven't written down, where Dr. Wick is saying the point is the control. I think it's during a montage of when, like later in the movie with Susanna's in her office and they're talking, but that's one of the things that Dr. Wick says. Okay, let's skip to this scene. I want to come back to the scene with Melvin and the parents, but like Susanna at some point is in Dr. Wick's office, and your point about the promiscuity and things like that, I mean, Susanna makes the point that female promiscuity is not treated the same as male promiscuity, and that so that a man could probably sleep around with more, and that is not considered maybe the criteria for borderline. You know, although now as someone who diagnoses that condition, we kind of look at it the same. We're trying to get away from this inherent kind of stereotypical thing of saying that men are more sexual than women, like they're more pursuant, because actually the research shows us that women are interested in sex and can be as sexually active as men. So like we probably should look at it the same way. So I just thought that was an interesting thing that Susanna was trying to say. Susanna becomes defensive when Dr. Wick is pointing out that she has, you know, or she commits sex acts, is what Dr. Wick says, with Toby and John, who's the orderly, in the same day, you know.
Right.
That's
problematic.
Yeah, that is problematic. It's not that you are doing those things. It's like, you know, you're doing it with some guy Toby, who's her, you know, boyfriend or whatever. Like that's the idea, which that's a loose term if we're going to use it with this movie anyway. But her boyfriend, and then this guy, John, who works at the hospital that you're in, who you don't even know.
Talk about not having boundaries.
Absolutely. John.
Don't do it, John.
Why are you crossing these boundaries, John? No, but this thing you're talking about, like, is Susanna different than these other people? Because Susanna is asking Dr. Wick, am I crazy or am I sane? That's one of her lines. Like, it's either or, right? Mutually exclusive, kind of all or nothing kind of a thing. Like, that's kind of the...
You're either crazy or you're sane. There's no room for gray. Borderline.
Yes, okay.
It's black and white.
I want to kind of segue kind of into that here in a second with this whole, like, maybe there is, like, some gray. So let's talk about the family scene then, if that's okay.
Yeah.
Okay. So
because it made me angry.
It made me angry too. So in my notes, I put Melvin with exclamation points because they're talking about her diagnosis, right? Like this is a family meeting that we would have today that I could have like in my office when I'm talking to people. And we're talking about what somebody is diagnosed with. So the parents are in there, they're asking questions, and the dad's like, what's this borderline business, right? And then Melvin says, I don't think that's very helpful to Susanna. What? To talk about her diagnosis?
She didn't even know she had a diagnosis.
I know, exactly. She was like, what am I diagnosed with?
Wait, what?
So that, just my...
So no HIPAA.
Right. Didn't exist back then. If we're looking at that, like, in terms of HIPAA even today, because we're going to make the assumption that Susanna was in agreement to have her parents there. So if I don't have, like, a release for somebody, because I need that now with HIPAA, I need a release of information if I'm going to talk to somebody about somebody's mental health condition. But if you bring them into the appointment with you, the understanding is like you're okay with them hearing, you know, that there's like that kind of blanket understanding.
I get what I got from that scene was that Melvin had been talking to the parents the whole time.
Oh, and then Susanna kind of came in later?
No, like before, like on the phone.
Like giving updates.
Telling them she has borderline, telling
and not
them all of these things, and then they come in for a meeting with her. They know everything. She knows nothing.
See, I did not look at it that way, but now that you say that, I can see that. I see that now. Because she's, you know, Susanna's shocked by her diagnosis, but I was just pissed at Melvin for being like, no, this isn't helpful to discuss with her.
Yeah,
that's unhelpful.
They said, oh, well, because later on Susanna tells Lisa about borderline and something else she doesn't know the name of because it would hurt her recovery.
No.
What?
I know.
Like, to have a diagnosis like that, you need to know what it is, recognize it, and accept it.
Yep.
And say, okay, this is an issue. These are the issues.
Yes.
And we're going to break them apart and we're going to work on them.
Right.
But if you don't even know...
Yeah, how are you going to help yourself?
And it's your illness.
I know. I was pissed for Susanna in this
And she was 18, but I think she wasn't married. So everything, because she was 18 and it was the late 60s, everything went to the dad.
Yep.
And if she had been married, it would have all been told to her husband.
Yep. I was like laughing. Again, this is supposed to be a serious movie, a serious kind of, but I think this was actually a kind of comical thing where like Susanna's mom in that meeting just breaks down and she's like, I can't do this, and like walks out, right? Eventually.
Yeah, and I'm like, you can't do it. You are not the one locked up voluntarily, but you can't get out.
Yep.
Which I honestly did not have a firm grasp of that you can voluntarily commit yourself, but you cannot voluntarily leave.
That's kind of how it is still today because, you agree to treatment unless there's some kind of court order and you get the probate judge in there and, she wasn't admitted under what we call like a pink slip. Yeah. Yes. That wasn't what was going on. We do that now, but yes, that still happens today. Like it's Dr. Wick says, I wrote it down. Dr. Wick says, you signed yourself into our care and we decide when you leave. That's what she says.
Well, and I can see how it would be dangerous to have someone check in and just be so
unstable,
ill and unstable and not recognizing it. And then they're like, doctors have, oh my gosh, not the Hippocratic Oath, but they do have
an ethical
thing where they need to treat people. Well, yeah, in a way that makes sense. But in other ways, it's like, well, maybe you just needed a nap for a couple of days. You were overwhelmed. Right. So you check in to get out and away from everyone.
Yep. Melvin makes the point of saying when they're talking, right? This was just like the last kind of thing about that scene I wanted to bring up was that when we're looking at borderline, he says it's 5 more times likely to be diagnosed in a person who has a borderline parent. We could segue into like talking about borderline right now, or we can go into another scene. But that was one thing I wanted to bring up about like what like people who work with personality disorders say about that.
And under my section of my notes, Kenzie questions.
Oh yeah. Okay, what is it?
How has the definition and the criteria changed all that much from 1968?
No.
Okay, because Lisa, when Susanna tells Lisa that she's she has some. Lisa says, that's everybody.
Oh my God, I marked that down too.
And so then, I've heard that a lot about borderline. My question was also, is this a common misconception of borderline that, like their definition of borderline in 1967, 1968, is that still the criteria that they use today in psychology and psychiatry?
For the most part, yes. The DSM over the years, because there would have been the addition that Susanna was diagnosed with, because it came out around the same time. That was like the DSM-3. Then there was the DSM-4 later, like approximately 15 years later. And then our latest one is the DSM-5. The criteria has not really changed. To be diagnosed with that personality disorder, there's 9 specific criteria. I don't feel like we need to go over all of them, but some general ones that...
like you have the unstable personality, right? Or identity, or what you think of yourself.
Your sense of self is lacking, I guess you could say. It's like you said, not stable.
Do you think they kind of float around and like pick up different...
Yeah, I mean that...
Like, oh, I think I'm going to be this now because whatever that was, I don't know who that was.
I think that, and also, too, what I've seen and what other, colleagues have reported and what I've read is that someone who has a really strong borderline, disorder, and what I mean by that is, there's varying degrees of it, which I'll kind of elaborate more in a second, but what we see is that sense of self is malleable to, oftentimes, to the people who are around them, so, we're going to talk a little bit here of that favorite person concept, and if that person with borderline finds their person, or let's say just a group of friends, they might change their identity, who they think of themselves, their interests, how they act to fit more in line with the group that's around them.
That's interesting because we've all known those those kids in high school, when we were young,
right,
that couldn't understand how their ideas changed based on who they were hanging out with. Or they would date someone and then, they hated, let's say they hated football, but then they start dating someone and that's their personality.
Well, and that's, that whole phrase of I'm going to make it my whole personality. That is something that we all do. We all can shift our identity, our sense of self. We shift our interests. We can include or exclude. We all do that. But I think
is that part of the maturation process, and you're figuring out who you are. And even now, I'm as an adult, there will be new things that come in, and I'm like, oh yeah, I'm obsessed.
I think that's just it's the human condition. That's the way our brains are. Like, even from as infants, as children, we're sponges, right? We're going to soak in stuff. But I think when it comes to borderline, it has to be affecting that person on like a higher level. It's not just like something that changes and then it's not going to disrupt regular life for that person. It's, right. It's to that extent. And I want to kind of talk a little bit more about that too, about how there's some talk about borderline being maybe just an extension, exaggeration, just problematic of like everyday life, normal individual things. We keep talking about how Susanna like has this diagnosis, right? But you and I haven't really gone into the diagnosis particulars yet. Mm-hmm. You just brought up the sense of self, that identity. That's like the main thing. But then also too, as an extension of that, and subsequently, when someone has like that instability, it'll then affect like the people around them, right? So that other component of the borderline is the unstable relationships too, like chaotic relationships. Clinical sign of borderline is intensity of a lot of things, relationships, emotions. So like there's a lot of emotion dysregulation, and that's why it often gets confused with bipolar, in my opinion. It can look very similar, but it's more short. The mood swings and the cycles are a little bit different. They'll be like a shift from a baseline mood to like a depressed mood to irritability to anxiety. It doesn't last as much as bipolar, but someone who is constantly shifting their mood and feeling kind of reckless, they'll be impulsive. So people with borderline can have impulses to do things that are more risk-taking behaviors, like gambling, taking out a lot of debt, like suddenly drug use, promiscuity, multiple sexual partners, just trying to escape reality, like escape their life. Like that's someone with borderline will do. Oftentimes, because of the emotional distress that they have and these intensity of these emotions that they cannot regulate, they can often resort to like violence, not only toward somebody else, somebody who might be triggering them, but there's lots of evidence to show that people with borderline will harm themselves in one way or another. We see that during the movie. Before we recorded today, we had discussed off mic about Susanna, this main character, like whether she was borderline or not, because before you and I rewatched the movie, we had talked about, well, maybe she's really not. Like, she's not as typical of borderline as we thought from before. However, I have some notes that I took, and they're my kind of evidence to state that probably, in fact, she is pretty typical of borderline. So I wanted to go over those with you.
I would love to hear them.
There's a lot of things that she does during the movie. Some of them are pretty subtle, but one of the first things that she does at the beginning of the movie is when she's in that first interview with Dr. Crumble, and he's asking her how she feels. She says, I don't know. Just a couple of minutes ago, we talked about like that intense, unstable emotion and not being able to regulate that. And it can be very typical of someone who has borderline, that when they're asked how they're feeling in a moment, they might not be able to articulate it because it could be numerous feelings at one time, and it's hard to pinpoint. People with borderline are more likely than other mental health disorders to attempt suicide, and there are a couple of times during the movie that comes up, especially because that's the whole reason she gets admitted to the hospital, when she's talking about her overdose before being admitted to, I almost called it McLean, it was Claymore, mm-hmm. Right? Before she gets admitted, she says that she has a headache, which is why she took the aspirin. And then when she's also talking with Toby about suicide, she says during their conversation, you make a stupid remark, kill yourself. You like a movie, you live. You miss the train, kill yourself. And I think you made a point earlier about little things coming to the forefront and like really affecting somebody, rather than
we wouldn't affect someone who isn't borderline. It's just like when she said that, mm-hmm. It's kind of like, okay, so I missed the train, but it doesn't trigger her. But maybe the next thing, like let's say mm-hmm. she misses the bus or what have you.
Right.
That could just send her over the edge.
Right. Yeah, I think it has to be with what is kind of going on leading up to that too, because like you said, like things could be calm and like that little thing doesn't trigger an disproportionate reaction, right? But then it can. Mm-hmm. And I think it was just interesting watching Jared Leto's expressions as Toby, as he's having that conversation. He's like not on understanding her. Like, he does not get what she's trying to communicate.
Right.
And then she kind of just is like, okay, we're not going to talk about this anymore. A couple other things that Susanna does that are indicative of like that borderline diagnosis. Dr. Wick is talking to Susanna during one of their sessions while she's at the hospital, and she asks Susanna, like, before you came here, did you have many girlfriends? And her response is not really. That kind of harkens back to that inability to maintain close relationships because it can be all or nothing. And if one of those person triggers you to become upset, you're like, okay, well, I'm just gonna reject this person. I'm gonna push this relationship away. And so we don't really get a lot of that backstory with Susanna, but that could be one of the reasons why she doesn't have a lot of friends, is because at that time she can't regulate her emotions.
Right.
Before I kind of give my other evidence about Susanna being typical of borderline, I wanted to talk about the scene after Lisa elopes, like she leaves.
Is that eloping?
That is what we call in the medical field, like if you work in like a hospital. So like that's really the only, that is the
I'm
only.
thinking escape.
I know. No, but that's like the clinical term we use is elopement. So like.
That's amazing.
Isn't that funny? So I don't know why, that's just what was taught to me. But like when I worked on locked units or units that are like monitored, so maybe they're not locked down, but like people cannot leave, we would classify people as elopement risks. Like, are they a risk to take off? Like that was a classification that we could give somebody.
I'm sure there are a lot of moms with non-borderline daughters who are like, is she an elopement risk? I need to know.
Yes. I mean, I think it's a fun way of talking about
it.
But yeah, when Lisa hightails it out of there, when did she steal the keys? I think, how did that first escape?
I feel like she must have gotten out the same way she did with Susanna.
Right.
Later on.
Right, later on, which we're going to talk about here in a second. But
I just figured she had been there for a while and she
knew all the escape routes.
How she could get out of there.
I think in the movie it says that she was there for 8 years. I mean, you're right. She's got to know all the nooks and crannies.
And if she is, I mean, if you think about that, she would have been admitted when she was a young teenager.
Right. Yeah. The impression
like
I get is she's older. Yeah, she's older than Susanna, but she's not that old. Yeah. That hospital's got to feel more like home to her than probably her own house.
Yeah.
I wish we had more backstory of Lisa.
And considering we don't have a backstory,
I know.
It's hard to know. Maybe she was in the system and then ended up in the psych ward.
Absolutely. But the one thing that I wanted to pick up on about Lisa when she leaves that first time, when Susanna's still left on the unit, Susanna's very depressed, not leaving the bed. Like you see like days go by and she like hasn't moved, right? And I love that Nurse Val comes in, picks her up, takes her to like the bathing room and like dumps her in a tub full of water. We talked about Val's tough love earlier, like that's the tough love.
Val like let her pine for her favorite person.
Yes. Yes.
Yeah. So, and then I feel like Val's like, okay, I'm over it.
Right.
and she should be too.
And then when Susanna's like, protesting of being in there, she's like, get yourself out. And, as Susanna's still trying to get the water off of her and is like
she's
shocked.
Incredibly cruel, Susanna.
Yes, because she's responding back to Val, right? Because Val is confronting her and she is critiquing her essentially, right? Because she says to Susanna, what, you can't hack it without her being Lisa. I don't know, I think you had said maybe earlier that you had written down in your notes that Val said to Susanna that there was nothing wrong with her, right?
That she was lazy.
Yeah, that she was lazy, self-indulgent, driving herself crazy. It comes back to like that minimizing when we were talking earlier about some of the symptoms, but then also Susanna's parents and about how there's this like a misunderstanding. But when you're talking about the cruelty that Susanna says to Valerie, I have down what Susanna's exact words were, which was, Melvin doesn't have a clue, that's her therapist, Wick is a psycho, and then to Valerie she says, you pretend you're a doctor, you sign the charts and you dole out the meds, but you ain't a doctor, you ain't nothing but a black nursemaid. And like the way that she says it too, she's like trying to be,
and she had
like,
a little song,
condescending. You're right. And like as a nurse practitioner that works in psychiatry, like that remark, because I've gotten that before from people thinking that like, I'm trying to act like a doctor when I'm doing my job. That hit a little close to home with me. I was able to like remind myself, Susanna's not talking about you. No, I felt like she was talking right to me. Like I was like, ouch, man.
Well, and I'm wondering, like Susanna with borderline, she knew exactly what to say to hurt the most.
Right. Well, and I think, She was hurting herself. One with Lisa being gone, and then what Valerie's trying to tell her to like snap her out of it. And so like, yeah, she's trying to inflict some damage.
However, can you just, I mean, I get what Val was trying to do. However, do people with mental illness just, I should snap out of it? Okay. I get that there is and could be some, not malingering, but just wanting to get better, I think, and working hard enough to get better.
Right. I think the point that you're trying to make comes back to what we talked about before, where she's getting kind of treated differently, right? Like people around her are saying that she is, we'll use the term ill because I can't think of anything else in this moment to kind of describe it, but she's ill enough to be in the hospital.
Right.
But she's not as ill as the other people. And so I wonder if Val does this because she's thinking that Susanna on a higher level can understand where she's coming from and pull her up by her own bootstraps type thing, you know?
She would not have done that to Polly, I don't think.
No. I don't know if she would have done it to Lisa either, because she probably would have been afraid that Lisa would cut her, you know?
Well, Lisa would have probably just eaten her flesh right off her bones.
Yes. That's her backstory. She's a flesh-eating.
She's a cannibal.
Yes.
I keep thinking that on the outside of the hospital, Susanna is not well.
Right.
And strange and weird and problematic.
Do you remember toward the beginning of the movie when there's the flashbacks and she's at graduation, the kids around her are calling her a freak?
Yeah. But in the hospital, she passes for normal.
Right.
Which is interesting.
Right. That point comes back to this idea of looking at borderline as maybe like more of a spectrum of behaviors. One of the things I wanted to mention while we're talking is that we're talking about 1960s treatment for personality disorders and other things as Susanna experiences it on this in a private hospital psychiatric ward. But more recently, a lot of people who work in psychology have found that looking at personality disorders as a categorical diagnosis with certain criteria that you meet it or you don't in order to get that diagnosis is not helpful when we're trying to treat it, because there's a lot of people, as we've discussed, I think, over and over the last hour, that the things that Susanna's doing, like some of the other women are doing on the unit, like they are maybe extreme versions of normal behaviors, things that we all do. And so I was listening to a podcast episode of Speaking of Psychology, which is put on by the American Psychological Association, and they interview people that work in the field about different topics. And they were interviewing Dr. Carla Sharp, and she was discussing her research in personality disorders, and they had found that when they did like meta-analysis and things like that, the way that we categorize personality disorders, and she was speaking mostly about like borderline, that it's not catching all of the particulars and how people experience that disorder, and how the research is kind of driving people in psychology of looking at it as there's a spectrum of things. And if you have dysregulation in your emotions, but also then your behaviors and things that would be falling under that umbrella of personality disorders, if you're experiencing that, it's going to be on a spectrum. So is it a time where you're having a low amount of symptoms, so you're low on the spectrum, or you're highly dysregulated and you're high on the spectrum? Like that's what Carla Sharp was talking about.
Okay, and that makes sense.
Right.
Because they say that Susanna is recovered when she leaves.
Right.
Does that just mean a lessening of intensity?
I think that's probably what they were trying to say at that time. She's not truly recovered, right? Like it's not like the treatment she was getting there was going to cure her of these things, but it was, to Dr. Wick's point, that control. She achieved some level of control, enough for her to be discharged from the hospital. But I think it's just an interesting way of looking at it. Like, and recovered is just like...
Would it be almost like you're in remission?
Yeah, I think remission would be a better word than recovered. When you think about the word recovered, like if we're going to take a literal look at that, like recovered, like was something lost? Did Susanna lose something and she recovered it?
Her mind, maybe. Is what, but I don't even think that's right, now that I've said it out loud.
I know, right? I feel like there's other things that we could say. And remission, I feel like, is probably better. It's not like gone, but it's just...
Yeah, because given the right circumstances and the right stressors at the right time...
Yeah, could be a hurricane again. Hurricane Susanna. Watch this year, 2020.
Again.
Watch this. Prediction right now, 2025, hurricane season, Hurricane Susanna.
Well, and then we can start being fortune tellers.
Psychics.
Psychics.
Yeah. Next podcast, psychic predictions. Was there something before the main event that you wanted to discuss?
You know what I was thinking about was the sense of community that Susanna has built in the hospital. And when they go for ice cream as a group, they get a day trip. And
lucky them. With their nurses.
Yeah.
Their babysitters.
So fun. And the wife of the man she had the affair with, the professor, was there and confronted her.
I love this scene in the movie.
And the way that Lisa just... Because Lisa does eventually come back.
She comes back and comes to Susanna's defense, right? Because the wife is confronting her in this public place, something that Susanna was hoping to avoid because she's like trying to hide from the woman the whole time they're in that shop. Which comes to my one of my questions, Carrie, I wanted to ask you was, do you think that Lisa's a sociopath?
No, because I don't think the scene where she defends Susanna is necessarily her showing empathy and kindness. I think Lisa was like, oh, I'm going to rip into this woman. This is going to be fun.
You think she was taking advantage of an opportunity, right, with tension? Yeah, I guess I could see that.
But also, I think she did care for Susanna. And I think she wanted Susanna to leave with her. She wanted, it's her person.
I think there was other ways that Lisa did show that she cared somewhat. Like with the painting of the toes of the patient that was in the bed, in the leather restraints, probably after receiving an ECT treatment. Like that was what that was supposed to portray. And then also too, when Susanna's in her room with Toby and they're getting hot and heavy, Lisa wants to prevent Nurse Margie, one of the nurses on the unit, from interrupting and doing bed checks. She does everything in her power to distract.
Right. Which I think if she were a sociopath, she would love to see.
She would want to see the drama go down. She would want to see Susanna get caught. But Lisa is empathizing with Susanna in that moment of wanting to have a private time with her boyfriend, because that's what Susanna's talking about. Toby is like her boyfriend, right? Even though that relationship is,
that was weird.
Yes. Just a weird part of it, but it's one of the relationships in Susanna's life. And I think the fact that it is weird and we don't really understand it kind of goes back to that point of like an unstable relationship, right? Like it just isn't the healthiest one.
Yeah, I mean,
right.
And I don't think when she first met him, she knew that his birth date was December 1st, and then it might be pulled for the draft.
And then it was. She saw it on the TV, yes.
Yeah. And then he shows up.
In desperation, right? But it's just very odd that he comes to get her to come with him, right? Like there's my suspicion, again, if we had more backstory, if this was like a more sussed out and more detailed...
A better story.
I think Toby is unhealthy himself.
Yeah, because it's like, you're moving to Canada forever. You can't come back to this country. So you go hunt down the chick who was...
Right, that you were sleeping with.
Admitted to the psych ward. It just...
Yeah, it doesn't make sense, right?
I think he was afraid and he thought he could get her to go. Because to him, why would she want to be in there? She should leave with me.
Right. And maybe he wanted someone to go with him as he's dodging the draft and committing like a crime, right? Because it was a crime to dodge. So he wanted like an accomplice. But, coming back to Lisa, the fact that she wanted to not have Susanna be embarrassed and like, again, also, I think she's empathizing on some level.
Yeah. Also trying to distract Margie is a game. So she's enjoying that too.
Yeah. She makes a scene, right? She's about to stab herself with the pen and Val is saying
in her neck.
Yeah, in her neck. She's like, I'll just stick it right in my aorta, and Val's like, your aorta's in your chest, Lisa.
Good to know.
Yeah. Great scene. Angelina, perfect delivery. Perfect. I loved it. I think the one big scene that comes to the climax of the story, Lisa and Susanna leave the unit
through the basement. And I don't know if we've explained, but at this facility there are several buildings and there are tunnels underneath so you can go from one to the other.
Yeah.
And
I don't think we've talked about the tunnels yet, so yeah.
Well, they're creepy.
Yes. Susanna loves them. Like that was something in the movies that she talks about, and also in her book, in the memoir, she talked about how she liked the tunnels. But yeah, they escape through the tunnels, and then Lisa's big idea is like, let's go find Daisy. Because at this point, Daisy's been discharged from the unit and she's living in the apartment, the townhouse that her dad has rented for her, that has leased.
And Lisa was very interested in that fact when she left.
That nosy bitch. She just wanted to go see what Daisy was doing.
I have a feeling that's probably when Lisa hatched that plan to leave. She's like, oh, so we'll have somewhere to go.
Yep.
And she bullies... She bullies Daisy and thinks, We can get something out of that.
Right. Maybe that was why Lisa, I don't know if it was Lisa or one of the other women, was asking her about the apartment, because there's scenes in the movie when they're getting details of like where this apartment is at. But yeah, so they show up. Lisa forces Susanna to be at the door, knock, ask Daisy if she can come in.
Yeah, she hides.
Yep. And then Susanna barters the Valium that she had been cheeking in the hospital to give to Daisy as payment for coming in, but Daisy's not aware that Lisa's right behind her, so that was great.
But she let her in.
Mm-hmm. Yeah, because I think
she wouldn't have gotten the volume.
No. Mm-mm. But the other thing is, like, so when they show up to Daisy's and Daisy's supposedly like in this better place, I think on some level she probably is, because she starts talking to Susanna and Lisa about their plans to run away and they're going to go to Florida.
And like logistics.
Yeah, she's like, do you have money? Do you have friends? Do you have family? Like, do you have a plan? And Lisa's like, no. Well, she says they're going to go breed princesses in Disney. Like, that's their plan. And like Susanna's laughing like it's a big joke and stuff like that. I think when Daisy is pointing out like that's not like a great plan, I think that triggers Lisa, because then Lisa starts really insulting and just
she goes after.
It's an attack.
I mean, she starts with asking for money for pancakes in the morning.
Yes, God forbid.
Oh,
yeah,
Lord.
And Daisy gives her the money for pancakes and puts it. Yeah, but then but Lisa can't.
But that was after she tore into her. She put the money and said, "Be gone in the morning."
I thought she was on the stairs and say, "Be gone in the morning." I thought like she puts the money down on the table in the kitchen for pancakes. She like pulls it out of her little, remember she pulls the money out of her robe pocket.
Right.
And she puts it on the table.
Right.
And so.
And then she goes up the stairs.
Right. And then that's when Lisa decides to reveal the big secret, right? Mm-hmm. The big secret being that Lisa says the way that Daisy was able to get discharged from the hospital was that she coughed up the big one. That was like one of her lines in the movie. Mm-hmm. But the big secret is that Daisy's father has been sexually abusing her and grooming her and has set up this apartment so that he has access to his daughter, who's a late teen or early 20s, you know?
And that townhouse, it was definitely decorated for the time, but it was like something a girl with a dollhouse would have put together.
Yes.
And I don't know if it was Daisy or her dad who did that. Mm-hmm. I mean, it could be either one. Him wanting to make her young.
Right.
And to stay young. And, I mean, to just reveal something like that.
Because I think
Susanna didn't know.
No, I think it was what was trying to be conveyed in that scene was that with Winona Ryder playing Susanna was shocked by learning this, right? And I think shocked by that, but then also the shock of like Lisa bringing it up, right? Like she makes like a point of saying to Lisa, like, we're here, like she's gonna let us stay here and you're doing this, right?
Yeah, and even when Daisy is on the stairs, Susanna's yelling at Lisa, stop it, like what are you doing?
Right. And then one of the points I wanted to make, bringing it back to Susanna and her borderline diagnosis, is after this big incident where Lisa and Daisy are trading these barbs back and forth where they're critiquing each other, and Daisy's saying to Lisa, like, you're not free and you're like basically like no one wants you, Lisa, you're not helpable, things like that, you can't be helped. After that episode, Susanna's so distraught, like does not know what to do with herself, and her first instinct is to go to Daisy's bathroom and go look for aspirin because she wants to OD. Like she wanted to take more aspirin and just like numb the pain that she's feeling, something that somebody with borderline would do.
Yeah, any sort of stress, and it's like a pressure valve maybe, and they're trying to relieve that, and that's what does it.
After Lisa and Susanna go to bed, Susanna wakes up. Lisa has already been to the store to go make pancakes, and Susanna's asking about Daisy, and Lisa says, haven't seen her, there's been music playing, all that stuff. And I think Susanna at that moment starting to suspect that something's up, because she goes upstairs, she's looking for Daisy, and you can tell she knows something is wrong. Like,
yeah, and I have no doubt that Lisa also knew what was wrong, and just, I don't know if she didn't care or if she just wanted to have Susanna find it.
Yeah, I mean, that's
out of
interesting.
I never thought cruelty.
I never thought about it that way. I could see that. I could see that happening.
That goes more sociopath, right?
I think they're trying to portray, Lisa as a sociopath, because when Daisy is found by Susanna to be hanging, I mean, this is graphic description, but she's hanging from the ceiling of her bathroom with her wrist slit. She wanted to make sure she did die. Like
she went for it.
Different ways to like kill herself. When Susanna finds her and she's distraught and she's like going to call 911, Lisa says to her, "Oh, what an idiot," when Lisa goes back up to the stairs, and then Susanna's calling 911 asking for an ambulance, and Lisa says, "Make it a hearse." I think those lines are like trying to feed into that narrative that Lisa is a sociopath, but it's just inconsistent with the rest of the movie.
Yeah, when she called her an idiot, I kind of felt like she called her that because you killed yourself over what I said to you. Really? Really, sweetie?
It kind of came off a little bit condescending, but sometimes I feel like we say that to people that we even care about too. Like, stop being an idiot. Like, oh, you're such an idiot.
Yeah.
Like, almost frustrated that she had done that. I don't know. That could be me reading into it too much.
I mean, I don't think Lisa was shocked that that's what happened.
No, because she said
and I think when she went at her the night before, she was well aware that this could send her over the edge.
Oh, yeah.
And she didn't care.
No.
And Susanna is truly
She's
just
distraught.
Traumatized over Daisy, and then Lisa decides need some money and goes into Daisy while she's hanging there. Goes into Daisy's robes in her pocket, whatever.
She goes rifling.
She rifles through her pockets
Yes.
and finds the money and some jewelry. Takes her rings off.
Pulls it off her fingers.
That was, to me, that's a certain kind of coldness.
Yes.
That is a certain kind of not giving one fuck.
Right. But if you think about it, like, probably hints to some messed up stuff that Lisa's gone through and seen. In that moment, Daisy's dead. She has no need for these things anymore.
Right. Well, if Lisa has had to be a survivor and take care of herself, she's lived in the mental institution, she'll get out every once in a while. I think for her it's about survival.
Yeah. A dead woman has no need for money and
or
for rings
or
and
anything.
Yeah. It is sad. And Lisa was just saying, to your point, that it put Daisy over the edge. It like tipped her, like all of that being known, like Susanna finding out the secret, and Lisa saying that they didn't release you because you got better, Daisy. They just gave up. Like, I think maybe that made Daisy reconsider everything with her life and just didn't feel like it was worth living. But then Lisa says to Susanna she was waiting for this excuse to do this, and I thought it was really, I don't know, I was touching when Melvin comes to pick up Susanna and take her back to the hospital, and he's crying on the way back to the hospital.
Yeah.
I think there's a lot of joking about Melvin throughout the movie, that he's like incompetent, that he doesn't know what he's doing and he's not helping and blah, blah, blah. But it really shows that, like, as a therapist, he cared about Daisy.
And if she had told him what had happened.
Yeah, he would have known.
And here, Lisa took the money and whatever. And Susanna, Daisy had a cat.
That cat.
And so that's what Susanna took. And that shows compassion on her part. Like, what would happen to the cat?
Yeah, there wasn't going to be any guarantee that Daisy's father was going to take care of that cat.
Right.
Like,
and something to nurture and to love. Like, and she brings it back and then keep it on the ward. And I just feel like, do psych wards or hospitals have pets on the unit?
Such a 60s thing, I guess we could say. Who knows? I don't know. I feel like
but they have therapy dogs. So I'm like, oh.
But they don't tend to stay there, It's like they get brought in and then they get... Because the other thing is, to keep in mind...
They can be violent.
Yes, people become unstable suddenly, right? And and if they're in like a psychotic episode, they might not know that the dog is, or the cat is the harmless. Yeah,
However, Polly, that cat, because I think when she goes screaming out of her room, has that breakdown about her face and the burns that she had done to herself.
When she's obviously an animal person, right? Because the burns were from not being able to have a puppy.
But I think she probably felt, and this is just conjecture, like no one would ever love her because of that. And then she gets this cat, and she can give that love to the cat, and the cat loves her. Cat doesn't care about the scars. The cat just wants to be cuddled.
Yep, absolutely.
And fed.
I think it's not so much of a leap to assume that about Polly, but this was Susanna's story, so we don't have a whole lot of Polly's story.
Probably could have had a movie about each character's story.
I bet you could.
Oh, miniseries.
I know. We could talk about just like how they decided to do this movie. It would have been interesting if the movie was broken up into the different perspectives of each of the women.
But this was made in 99, and I don't think that was a big thing in movie making back then. I mean, I'm sure there were movies that did that, but it wasn't...
Well, and supposedly, I was reading online somewhere, I can't remember, but I remember them saying that, like, the people who bought the rights to the book, to the memoir, had trouble translating the book into, like, a screenplay.
Obviously.
So, yeah, I mean... I think they got it as best as they could.
Yeah, but and when you read that memoir, not that this is about the memoir, but
hey, I liked the memoir. I think it reads really well. I loved it.
Yeah,
it's great.
I loved it, and that's why maybe I'm more disappointed with how the movie goes.
Yeah.
But you're in the movie, you're kind of like Susanna, like you're seeing it through her eyes. You don't know everyone's backstory. You don't know everything.
We don't even know Susanna's backstory.
I would love to know.
Because that was one of the things I liked at the beginning. I think I told you this earlier when we were talking, but I liked that at the very beginning when we're trying to kind of get information about what led up to Susanna's suicide attempt, which is like that first emergency room when she's been found to have overdosed. When we get like her little snippets of a backstory, it's those flashbacks. Like, I liked that part of the movie.
Yeah, it's set up for you kind of some context with Susanna, but with the other women,
it would have been nice.
And you know, the older I get, the more interested I am in. My God, how someone is acting this way. Well, what led to that? Why did this? I find that very interesting. Just to watch a movie that you know almost nothing.
Right.
I want an emotional connection. I can't get an emotional connection. However, Angelina Jolie probably sounds insane. Favorite character of that?
No, absolutely. She
movie.
is. I mean, that's why she won all those awards. I think I said this earlier. She makes the movie. The big personality. She's got that, as the kids say, main character energy, right? Like, I mean,
who are these kids?
I know. The kids I talk to in my work, but Susanna's the main character, but Lisa's got the main character energy. Like, there was something that Lisa actually brings up that I feel like is maybe what the movie's kind of setting it up as. So, like, the end of the movie is after Susanna's been deemed to have been recovered, right? And they're getting ready to discharge her. She's packing up all her shit and getting ready to leave. She wakes up in the middle of the night, right? And she hears a banging or talking or something, right? And she wakes up, Georgina's not in her bed, and she can't find anybody as she's wandering through the halls. And then
all of a sudden she hears Lisa
reading her journal.
Yeah.
Yep.
Which is everyone's worst nightmare.
Boundary violation.
Yeah. Yes. What are those?
Right, yep. Lisa doesn't know. Nope. So Lisa's reading these journal entries, and then Lisa's upset at what Susanna's written. I don't remember what passage she's reading out loud, but I think it has to do with Lisa, or has to do with one of the other women. And then
because she does say stuff about Polly.
Yep. And then Georgina too, because I think Lisa reads out that Susanna is questioning whether Georgina's like a liar or something like that, you know, like doesn't think that Georgina's like super sick or something like that. And then Lisa is talking about in front of these women about Susanna, saying that Susanna's writing all this because she wanted to be the hero in her own story. And then Lisa's like, you're making me out to be the villain.
And she says, I'll be your villain?
Yeah.
You know, it's just kind of like, fine with me, sister.
And then that's when Susanna, you know, typical of her diagnosis, right, and what we've talked about, like when she is made to feel embarrassed and hurt by what Lisa's doing.
And she's literally trapped on a staircase with a door that's locked, and Lisa's behind her.
Yeah, and so she says to Lisa, no one cares if you die. And then she also says, I've wasted a year of my life, which I think she really wanted to hurt Lisa with those comments because...
Well, she also says, you're already dead, which broke Lisa.
I got emotional, I think, watching that too.
I did too, and I didn't feel any sort of empathy for Susanna. I felt it for Lisa.
Yeah. With all of the way that Lisa acts throughout the movie, you know she's hurting. You know that she's acting from a place of hurt.
Yeah, you know that there's a reason for it. She's not malicious just to be malicious. Something has happened.
Yeah, there's too many moments in the movie where she has like a little bright spot of being compassionate in some way.
Or even like...
She's not like a true villain.
Kind of light, almost. Yeah. And she's enjoying herself.
She's a complex character. She's complicated.
Yeah, and I guess that's the thing. She's the only complicated one.
Yeah.
I don't think Susanna's complicated.
No, I don't. Georgina's not. Polly, we don't get enough to see that. Daisy's a little complicated.
Now, Daisy, she's a bit of a mess. Not her fault.
Yeah.
Susanna is so one-dimensional to me.
Yeah. If I were to go back and look at like reviews of the movie, I wonder if that was like in there too, because I have that feeling as well. Yeah.
Poor Lisa.
I know. Like, how can we be appalled by
it broke her.
Mm-hmm. How can we be appalled by Lisa's behavior, but at the same time just want to give her a hug? You know what I'm saying? Like,
and to feel empathy for her.
Yeah.
And like, Susanna, you bitch. You leave my Lisa alone.
No.
It's a strange. You're the psych person. So.
I'm the psych person. Yeah.
So why would we?
Because I think on some level we realize that most likely horrible things have been done to Lisa. And she desperately wants to be a part of something. Like, she has a community on that unit of those women.
And since she had been there so long, that was her unit. Susanna's an interloper. Susanna comes in and writes all this shit about people that I don't think Lisa would say she loved them, but these were her people.
Right.
For better or for worse, her family. And Susanna just comes in and picks everyone apart.
I think she's still, if it's to prove it to herself or to prove it to Susanna, Lisa makes a point, because like at the very end of the movie, maybe not quite the last shot of the scene, Susanna is getting ready to leave the hospital, and she goes to visit Lisa because Lisa's getting ECT treatments that I looked it up, and it's not really a treatment for borderline at any point in history. So like, I don't know about in the 60s, and now it's not like, they don't use ECT.
Or for a sociopath.
No.
It's like, that's not going to change it. They're trying to make Lisa compliant because she was getting a lot of ECT.
I mean that's a theme with mental health. If we just want to look at the history of stuff, like look at like what lobotomies were.
Oh my God.
That's
I watched a documentary on lobotomies once. I don't recommend.
not watching it or having the lobotomy.
Both.
Both. Okay. Yeah. I mean, Susanna's visiting with Lisa. She's strapped down to that hospital bed, and Lisa paints her nails, and so. Susanna paints Lisa's nails. Yeah. I'm sorry.
And Lisa just looks like such a broken little bird of a person, and she's obviously been crying, and she looks at Winona Ryder and says, I'm not really dead. And at least Susanna says, I know, but it made it was like, it's almost like they're trying to show that what Susanna said to her has helped her have a breakthrough. So I wrote in my notes, Susanna turned into the crazy man's Jesus and healed Lisa with her hard-hitting truths. Way to go. And then at the end, the very end,
yes,
after she's picked up by the same cab driver.
I know.
And she introduces herself, and he acts like he recognizes her.
I think he does. He says, he's like, oh, I remember you, or something like that. Yeah.
In that moment when Susanna is talking about being there, she uses the same judgmental assholery that the outside world did. And I would hope she would come out with compassion for people who are struggling. But I think there was enough of her being the other and passing for normal in there that I don't know if she left gaining any empathy or insight into other people. Yeah. And maybe that's a borderline thing, but
I don't know. No.
But to just be, I guess for me, it's like if I go through something, when I see other people going through the same thing, I have empathy for them.
Right.
I'm not going to go out and tell people these judgmental, ridiculous things.
We've compared a lot, like the movie to the book, but like in the book, Susanna talks about how like she saw people after the hospital, like people came to visit her. She went to go visit them.
She and Georgina stayed friends,
and she saw Lisa. Yeah, and she had a kid. Spoiler for the book. Do you remember that part?
I think in the book, she said that Lisa, she saw her in Harvard Square with her child, and that she seemed fine, her quirky self. So then that led me to a whole thing with the book of, is she a reliable narrator?
Right.
Because if she was a sociopath,
yes,
I would say this is once again, we are talking about the movie, not the book.
Right.
And in the movie, I have a feeling she was amped up a little in that portrayal. And so, do you think this movie is trying to be like anti-borderline diagnosis? Are they trying to say, oh, this is the thing? I felt like the movie's saying she, at that time, Susanna was a little outside the norm of her very upper class life, and therefore they sent her away. And so she didn't have a mental illness, it was growing pain. But the age Susanna is when people are normally diagnosed.
Yes.
I don't know. It was a conundrum.
I think it was two competing interests, right? I think there was the competing interests of her family and the people of her community and like Dr. Crumble or whatever, the local guy that they knew. And then when she came to the hospital,
right? The movie.
Yeah, I think when she came to the hospital, Dr. Wick, Melvin, the other staff members there really did realize, oh yeah, this isn't just her being a lazy, indulgent girl. To use
the girl who is sent into the parochial school halfway through her senior year because she was sleeping around at her public school and her parents are horrified. Oh, we're going to house her over here at this school.
Yeah, she'll get some correction with some Jesus in her life right now.
And it's like now Susanna, it's almost like they sent her there to scare her straight.
Yeah.
And like, in this society, this is not okay.
So Carrie.
Kinsey.
Thinking about the book, we...
that we're not talking about.
No, the movie. I'm sorry. So Carrie, thinking about the movie, we had talked about before, like when we're reviewing these movies, we're going to say like whether we loved the movie, we liked the movie, we didn't hate the movie, or we hated it. What do you think about Girl Interrupted? What is your opinion?
If I were 23, I would tell you I loved it. But at the age I am now, solidly middle-aged,
Matronly.
I would say...
Are you maybe neutral? We could always do like
I'm almost more... Well, no, what was the third choice?
The third choice. This is your memory issues popping up. The third choice was you didn't hate it.
I would say I don't hate it. And the reason I don't hate it is Angelina Jolie.
Girl, I agree with you.
That goddess of a woman. Just the emotion she brings. And she was Lisa, she embodied that.
Oh yeah, like she's humorous too. I mean, like her antics, they're both like what the hell, and they're also like laughable. You can.
And with the aorta and the pen, she's mischievous.
Right, my aorta. Yeah, I liked the movie. I would say I didn't love it. Now, you were saying, like, if you were 23, saying that you would have loved it.
Which is the year, when the movie came out in 99, I would have been 24.
What I was about to say is, like, before I had just watched the movie and had not read the book, I would have said I would have leaned more toward loving it. But honestly, after reading the memoir...
It's so good.
It is so good. It reads like...
Not that we're saying don't watch the movie, but if you watch the movie and you liked it...
Yeah, you should definitely... And it's a quick read, too. Yeah, I loved the book. So I think I liked it. And so people listening at home, Carrie and I had previously recorded opening up a slip of paper from picking a new movie from our jar. However,
because we had a bit of a technical issue.
Yeah, that recording is lost. And so what we're going to do is announce now what our next movie will be, and we'll save the ASMR content for the next episode.
Yes. But I got to pick it because you picked this, and I ended up pulling...
Do you remember?
To the Bone.
To the Bone, yes.
You saw the panic in my eye when I was like, oh.
I was going to catch you, girl, if you fell.
Thank you.
You're welcome.
Women supporting women.
That's what I do. So yeah, we're going to watch To the Bone next. That'll be our next episode. Be sure to tune in.
I just watched it last week.
I was psychic abilities. You're honestly...
I was sick, and I'm like, Keanu. So that's what I did.
So yeah, we'll watch that movie. I've also seen the movie, but it's been a long time since I've seen it, so I'll rewatch it, and then we'll review it. And
at some point, we're going to watch movies together and maybe have commentary.
Yes.
Maybe some video on YouTube.
And if anybody has a suggestion of a movie that they want us to review,
in this theme
of having some kind of mental health component that needs to be discussed and dissected, we will watch it. We'll have to do our advisory committee, which is me and Carrie, review the suggestion and make sure that it fits. But
we're it, people.
Yeah, this is it. So we'll review it, but yeah, be sure to make a suggestion on any of our socials. You can go to www.muchmadnesspodcast.com and you'll see the full list of the movies there. It'll be up there. It won't be on our social media platforms because it's a lot of movies to list, but find it on the website, make a suggestion, and we'll add it. All right, well then we'll see you next time.
Hopefully.